Hello and welcome to this very important pro-life program where we bring you Dr. Alfred Kratochwil. He's a pioneer in the development of ultrasound, one of the first people to develop ultrasound, if not the first throughout the world. He's a physician in Vienna and was born in 1928, and I'd like to introduce him to you now. Dr. Kratochwil, thank you so much for joining us.
Thank you for inviting me.
I want to talk so much about your career as a physician. You were born in 1928 and went to medical school here in Vienna.
In Vienna, yeah.
And you graduated in the 1950s, and within 7 years you were already head of your department in obstetrics and gynecology. This was at the Second University Frauenklinik, or Women's Clinic in Vienna. So you were obviously, as the Germans would say, a clever fellow, kluges Kerlchen, no?
Okay. No, you have to know as well that in the beginning you have to do different specialties as well, in case you want to become a general practitioner. And we started this for...
So you had general training, right?
And then afterwards I started the special training in OBGYN.
Now I understand you're also an internist as well, is that true?
No.
You're just a specialist in obstetrics and gynecology. Yeah, and you actually met your wife early on when you were only in your teens at a Catholic youth group.
Catholic youth group in St. Anton von Padua. It's in the 10th district in Vienna.
It's in Vienna.
Yeah.
And then it was several years later that you would marry, and you have 5 children and 6 grandchildren?
Yeah.
Which is wonderful. Before we get to your stellar career in the development of ultrasound, I want to ask you a little bit about your family.
Yeah, please.
So you came from a Catholic family, your wife as well. What role did Catholicism play in your early life?
Well, we went to the youth group there, and so we met in several times in between the Sundays. So we had meetings there as well, and this was quite nice because we have as well to take tours together and so on and so on.
And you were obviously, you took your faith seriously. You went to Mass every Sunday and so on.
Yeah.
Did Catholicism, you said, didn't really play a role in your interest in becoming a physician? You just had an interest in medicine from early on?
From early on, yeah.
From early on. But you didn't know it would be as an OBGYN yet?
No, not yet. Because you started as a normal practitioner, and then you look
to see what interests you.
What's interesting you. Yeah.
Now, when you married, were you a physician already, or were you still in training?
Oh, just at the end.
Just at the end of your training. Your wife conceived a son, your first child, whose name is Wolfgang.
Wolfgang, yeah.
And I understand that there were difficulties with the delivery, which would
He's
later...
brain damaged, yeah.
Yes, he was brain damaged because of his delivery with forceps, and she had...
eclampsia.
She had, pardon me?
Eclampsia.
Yeah. Oh, she had eclampsia as well, preeclampsia. With this high blood pressure and with the brain damage and so on, was this crucial to your interest in developing early ultrasound, or did that not come till later?
It came till later.
It still came later.
Yeah, it came later, yes, of course. At this time there was no ultrasound available.
No, none at all. What's interesting to me is as early as 1964, so that's before I was born, you were already working with something called X-ray placentography, which I guess was a predecessor of ultrasound? Yeah,
it was the primary interest, because you have to have in mind that at former times when a wife had bleedings in the second or third trimester, you couldn't see it by X-ray or other things.
So you didn't know the cause of the bleeding?
They stayed weeks and weeks
in the hospital,
at
bed rest. And so your primary interest was really trying to help women and trying to diagnose where the placenta was and how healthy the baby was, correct?
Yeah.
I think it's fascinating that you actually developed an interest in ultrasound by visiting a neurosurgeon who was talking about cerebral bleeding, so bleeding of the brain, and you thought to yourself, this could be used in obstetrics.
No, it was a bit different, because at former times we had in the possibility each week to listen to somebody talking in
one of medical societies, yeah.
Medical societies. And there I found that one guy was doing this ultrasonic examination because I had a very big difficulty because I used isotopes to localize the placenta.
Okay.
And I presented it.
Was that very difficult?
And it was not difficult, and it was absolutely harmless, but nobody who didn't understand anything from it, they shouted and wanted me to
stop.
To stop, yeah.
Yeah, yeah.
And then, of course, I had as gynecologist responsible for patients which were laying in the intensive care and looked there for them. And then I met there a really nice man, and we talked about it, and I asked him different things, if this and that would be possible, and he said, yes, there's no problem, you can do it, it's no harm. And then I developed the X-ray, the ultrasonic examination.
Wow, and you were the first person really to do interventional ultrasound, whereby you were making amniocentesis safer for the mother and for the child, which I guess was not so safe. That came later.
That came later on, but primarily it was as well that you were able to see where is the placenta located. Is it really a placenta previa, or is it a normal...
Is it a normal pregnancy or not?
A normal pregnancy, and the reason for the bleeding was quite different.
Yeah, and then you could diagnose and treat better before the baby was born. You were using a so-called A-scope that was developed by Kratochwil, a company, and
A-scan.
A-scan, it's called in English. A-scan, and this was, if I'm correct, the first machine you used for ultrasound. Correct?
That's correct.
And you were able finally to locate with 90% accuracy where the placenta was, where the baby was.
Yeah, it was different because you had to look inside, because you had only blips of the...
like radar blips almost.
Like radar blips.
So you didn't have the pictures yet like today?
No, not this come later on.
That came later.
That came later.
In December in 1965, you presented your findings at the Austrian Society of Gynecology and Obstetrics.
Yeah.
How was that received?
Yeah, differently.
Because I know my father, who was a physician, said a lot of the time when physicians come out with some new idea, like the idea that you should wash your hands before delivery, a lot of the old-fashioned doctors fought it because it wasn't the usual way. So I wondered if your findings in ultrasound were considered controversial in any way.
Well, anyway, they said, let him work.
Let him work? Just let him work?
Just let him work. If it's not good, then it stopped anyway.
You said, yes, I'm sorry, go ahead.
But then anyway, as they saw as well the success of it, then they said, okay, we will see and do
We'll
this.
see what happens, yeah. You said there was only one person who did any ultrasound work in the world before you, and that was Ian Donald in Scotland. What exactly did he do?
He examined as well the
placenta?
Not the placenta, he had the first B scanner, where he had, instead of the blips, lines. And this was very nice. Because
so did it have pictures then?
They had pictures, yeah.
They did have pictures, and you later received an honor from his widow in honor of your work in ultrasound.
Jan Donald medal.
That's wonderful. That's absolutely wonderful. How early now can people see the fetal heartbeat? I mean, you were able to do it as early as 6 weeks, which was a huge miracle at that time and brand new in the medical field. Now they can probably detect it even earlier?
Even earlier.
Even earlier. How important is it really to hear the fetal heartbeat?
No, to see if the baby is alive or not alive. Because I remember one case which was quite interesting, because he had always good friends in the clinic.
Yeah, yeah.
And he told me, you diagnosed a baby with fetal heart action. That was only a scan. And 2 days later, I learned that during the night time they were going up to the operating theater to operate the patient because this was an ectopic pregnancy. It was
right. It was in the fallopian tubes, yes.
In the fallopian tubes. And so nobody did believe it. But anyway, they had to go.
So they used the ultrasound when you weren't there?
No, they didn't use it.
Oh, they didn't use it?
They didn't use it. I used it before and said, the baby is alive, I have a heartbeat. And then they came down and said, what you are doing? We have operated this patient, made a curettage, there was nothing inside.
Because they looked in the wrong place.
They didn't know that it's an ectopic pregnancy.
Right.
One day later, I come in the morning and said, today they went up during the night time to operate the patient before ectopic pregnancy.
Because they discovered that she was...
it ruptured.
The placenta ruptured?
No, not the placenta, the tube ruptured.
Oh, the tube ruptured.
Yeah.
Okay, I see. Wow. So they should have listened to you. Then everything was silence. Interesting as you went on to work with Kretstechnik to refine ultrasound machines.
Yeah.
And this was over many years?
Yeah. I would say between 25 and 30 years.
Between 25 and 30 years.
Yeah.
So you saw great improvement in the use of the machines and were able to have active involvement in how the machines worked and what they showed.
Yeah.
Was it? I mean, how did that work exactly? Did you tell them what you wanted, or did you give them feedback on how it helped you, or how did that work exactly?
No, anyway, it was quite interesting for the chief of the hospital of the gynecology department.
Of course, yes.
Professor Huslein. At first he said no, and then he saw the success, and then he get many calls. May I send one of my doctors to Vienna to learn this ultrasound and so we developed a great
relationship with Kretstechnik. Yeah. Do they still make ultrasound machines to this day?
Yeah, of course.
Of course. They became very famous, I suppose.
Kretz was then bought by...
it doesn't matter, but it's owned by another company now?
By now.
You actually, to me it's quite amazing, you trained hundreds, maybe thousands of physicians, not just obstetricians, but also radiologists, in how to read ultrasound and how to use ultrasound from all over the world. It
was quite interesting, because at first they were testing me, of course, and sending the patient, and I remember one especially where the professor, the ordinarius.
He was called, the ordinarius, yes.
Ordinarius came with a patient and said, this patient had a pleural effusion.
Okay.
I don't know where I have to insert the needle.
Okay.
Could you help me?
Yeah.
And said, pick here. It was the deepest part, because if you insert the needle too high, you can't release it. So he was quite content with this.
So you told him where it was, and he was able to...
Yeah, he sat by me, made a point, picked in. 1 hour later, he called me, worked perfectly.
Worked perfectly. And for people who don't know what a pleural effusion is, can you explain what that is?
It's liquid in between the pleura and the lung.
And the lung. That's what I was going to say, near the lung. So they had a liquid
in
the lung that they had to remove.
In the thorax.
In the thorax, okay, that they had to remove. You also went on to write the earliest textbook, or one of the earliest textbooks on ultrasound. That was in the early 1970s. You wrote over 300 papers. You published so much material, some people thought you were actually a surgeon or a member of another specialty, because your work crossed over into internal medicine and so many other fields. How did you find time to do all of this and work as a physician as well?
It's quite interesting, because the others were becoming interested as well, of course. Therefore, as I told you, the one from came, boy, I have to insert my needle. Another surgeon was coming with a boy, 12 years of age, He had a pancreatic cyst. He had an accident, fell with his abdomen against a rock.
I fell against a rock, okay.
And then developed a sort of abscess and cyst inside.
An abscess, okay.
He punctured.
He punctured it, right? With a needle?
With the needle, with the needle, but too less. 2 days later, or 4 or 5 days later, come again. It refilled.
It refilled, so he didn't get the right spot.
Yeah. He had the right spot, but it was not all removed.
Ah, okay.
Therefore,
he came to you and asked to use the ultrasound to see if there was still...
One of the nicest stories as well, I had a guest and we want to go for lunchtime.
Okay.
And the normal was not open, so I hired a taxi and we went somewhere. And I wanted to pay, and the taxi driver turned around. Aren't you Dr. Kratochwil? So yes.
Yes.
You have diagnosed by me this and this. I was operated, I have no pains, you don't pay anything.
You don't have to pay me. Oh, that's a lovely story. That's wonderful. You eventually became the head of the department of the ultrasonic diagnosis at the university's female clinic in 1972. Mm-hmm. By this time you were married, and you went on to have a total of 5 children. Mm-hmm. Of course, you raised them Catholic as well. And you said your wife was very Catholic too. Mm-hmm. Unfortunately, she passed away how long ago?
Mm-hmm. It's now 9 months.
9 months only. We're very sorry. We'll pray for her. You had 5 boys.
I have 5 boys.
Now,
and the one is brain damaged.
One is brain damaged, and being cared for.
This was typical, of course, of this time.
It was very typical, was it?
Because I don't tell the name, of course, but this was a assistant, a high one, and it was late in the evening, and he said, okay, we will have a good rest in half an hour in the administered contractions.
Yeah, he induced the baby. Mm-hmm.
And then everything stopped. Then they have to perform
they had to use forceps to get the baby out.
Mm-hmm. And then he had the brain damage.
And this was your first child. It must have been devastating. Yeah.
He's living now in Sollenau. Sollenau, where you have all this...
a kind of a home where they care for him. Yeah. Obviously, even though you were an obstetrician, you didn't deliver your own children, correct? No. But you would have been in the room and known what was happening. So.
Oh, not just around.
Oh, just around the corner. Okay.
Just around.
Because I know in those times the husband wasn't allowed in the room, and things were much different than today, where they want the husband to participate in the birth and so on. In 1973, you founded the Austrian Ultrasound Society. Mm-hmm. You've written 4 books. You've been in 4 educational films, and you've also played a role in 3D. Mm-hmm. Of course, we even now have 4D ultrasound, which is amazing. And you were doing this as late as the 1990s when you were a professor. Where was it? The University of Vienna. Mm-hmm. And so you were teaching the use of 3D ultrasound and some of the techniques that you had discovered.
Yeah, we have regular teams or regular times where we had to educate other people, so it was quite nice to work there. So
so that was your in quotation marks, that was your retirement, sort of, when you went to teach instead of practicing medicine as a physician every day?
No, that wasn't the end, because it was some problems in the clinic and I left, and I became primarius in Baden, in the Geburtshilfe in obstetrics and gynecology. Yeah. And I worked there for another 2 years and brought them up again from few deliveries up to 200-300 a year, because all others were going around to Mödling and other.
When did abortion become legal in Austria?
I don't know.
You don't know?
No.
I know that ultrasound and our viewers and listeners will know this, ultrasound is extremely important, I would guess in many countries, but especially in the United States, in the fight against abortion, because pro-abortion organizations like Planned Parenthood fight in court so that the pregnant women cannot look at the ultrasound, that they are not required to show the ultrasound, because, of course, in your ultrasound, you can see the baby.
You can see the baby, you can see the heart action, you can see the movements of the baby.
You can see the baby sucking its thumb?
Oh, sometimes.
Sometimes? You know if it's a male or a female baby?
Not so early. Because
not so early? How early?
Oh, I would say in the third month or...
Third month or so, okay.
Until this time, most times...
Not so early. Yeah, sometimes the baby is coy and doesn't want to show you, right? How does it feel knowing that your invention has been used, first of all, to save incalculable numbers of babies, women who changed their mind because they saw it's not just tissue, it's a baby.
Yeah.
How does that make you feel? I would think you would feel very humble.
Yeah?
Yeah?
It's good that you have the possibility to show them, because they weren't educated enough to know
that was a real baby.
That was a real baby, no? Some cells, nothing else.
Yeah, and of course you knew better all along.
You
Even
just
today,
let them see.
Come see the baby. It's also important to note that the ultrasound has also made pregnancy much safer for mothers as well, correct?
Yes, of course.
Can you explain a little bit how?
No, quite clearly, because you can see at first the position of the baby inside. You can already calculate in a normal time where no delivery is near around that the baby is normal in the head position, or it's a breech presentation, it's
right.
or it's a transverse position and so on.
Right. So that helps with delivery, as well as early detection of problems with the baby, so that you can intervene now these days and often even do surgery before the baby is born.
Of course, yeah.
There's a very famous picture of Michael Clancy you might have seen, where the little baby is being operated on, and he reaches his little hand outside the womb and he's holding the doctor's hand with a finger. That's a beautiful picture.
Yeah.
That's a beautiful picture. Tell me a little bit how you feel as a Catholic playing such a role in preserving life. Humble. You're a great man, and it's an honor to meet you.
Thank you.
And I would like to thank you so much for being on our program.
Thank you.
And God bless you, Doctor. Thank you so much for all that you have given to the world.
Yeah, thank you.
And with those words, I'd like to thank you for joining us as we interviewed the inventor of ultrasound, Dr. Alfred Kratochwil, who's a physician who is 86 years young and still lives here in Vienna. Thanks for joining us.